A health alert tonight on the 10 o'clock news. According to a new study just released by the CDC, 3 out of 150 veterinarians who work with large animals have contracted bird flu. The vets didn't even know they had it until they signed up for a study to see if bird flu antibodies could be detected in the blood.
Antibodies indicate they had the bird flu, although they didn't have symptoms of an infection. News 4 Jax reporter Eric Avanier joins us now here in the studio tonight to explain what this all means for the general public. Eric?
Well, what it means generally is that bird flu infections went undetected. Right now, there is no evidence that the virus has spread from person to person, but it can spread from animal to person. This is what the bird flu virus looks like under a microscope. To fully understand how the virus is spreading from sick birds to cows and now humans, while at the same time causing the cost of eggs at the store to skyrocket, I consulted with Dr. Michael Koren, the director of the Jacksonville Center for Clinical Research, who oversees clinical human trials of vaccines for an array of illnesses.
It's unusual for flu viruses to move from one species to another, but it does happen. And the reason for that is that each flu virus has specific characteristics that allow it to infect certain cells.
In other words, viruses mutate into strands that then hop from one species to another. This computer-generated model of a virus shows how that mutation may look.
So in this case, we know that there's been transmission from birds to cattle. And the question is, will it go from cattle or birds to humans? And there have been a few cases, none in Florida so far, but there have been a few cases. And that's the concern. If that trend continues, or if there is a mutation that creates a problem and then this becomes highly infective to humans, then we have a problem.
The CDC says blood tests revealed 3 veterinarians who work with large farm animals had at one time contracted bird flu because they now have bird flu antibodies in their system. 2 of the 3 veterinarians had no exposure to animals that tested positive for the bird flu, and one of them who tested positive was working in a state that at the time had no reports of bird flu activity.
Although there wasn't a record, you have to assume that either there was some problem in the history of these veterinarians and maybe they were in a different state and they didn't remember, or in fact you have this problem in that state.
Either way, their infections went undetected because Dr. Koren says they were either very asymptomatic or had symptoms so minor that they paid no attention to it. The CDC release of that information about the 3 veterinarians comes after Ohio health officials announced the first bird flu infection in a human in that state. The infected person was a farm worker who came in contact with a sick bird. He suffered severe respiratory problems and had to be hospitalized. Here in Florida, there have been multiple reported cases of bird flu infections in farm poultry and non-farm poultry, but no reported cases of people infected with the bird flu.
With bird flu, you would have to do a lot of testing.
Dr. Sonia Rashid is an emergency room doctor at UF Health. She says the bird flu can have symptoms like the ones on your screen that mimic the seasonal flu. It's only when a patient is admitted to a hospital that they get a full viral panel of tests to determine if they have contracted bird flu.
And if we had a patient that had bird flu, they would probably be placed away from other patients in like an isolation kind of setting.
Is that to keep them from spreading it?
Exactly, just because those types of patients can get really sick.
There is currently no FDA-approved vaccine for bird flu infections in humans, which means the virus must run its course. The only things doctors can do is treat the symptoms.
So if their blood pressure is low or they're dehydrated, giving them fluids. If they're having a fever, giving them medications to treat their fever. Sometimes with the flu, you can get respiratory illnesses such as pneumonia, and that would require antibiotics.
Thankfully, hospitals here in Florida have not had to deal with patients suffering from bird flu. Now, medical experts say people with weakened immune systems are more likely to have a tougher time with bird flu infection. This is also yet another reason why people are advised to cover their mouth when they cough or sneeze and wash their hands. Reporting live in the studio, Eric Avanier, Channel 4, the local station.
Eric, will the regular flu vaccine help if you get infected with bird flu?
Well, both doctors I spoke with say the seasonal flu vaccine we get every year will not affect bird flu because seasonal flu vaccines are not designed to work on bird flu. However, scientists are looking into that messenger RNA technology used in the COVID-19 vaccine to see if that may someday work against bird flu.
Eric Avanier reporting for us live here in the studio. Eric, thanks.